Good evening and welcome to the June 23rd, 2020 meeting of the East Long Meadow Town Council. Open the meeting now with a moment of silence, and we ask that you continue to keep our first responders, servicemen and women, and all of our government and public health officials in your thoughts this evening. Thank you. In accordance with Mass General Law, this meeting is being audio taped and videotaped, as well as remotely taped. If there is anyone in our viewing audience doing the same, would you kindly identify yourselves? Do you see anyone in our?
I do not.
Okay. Then we can move to number 3 on the agenda this evening, public comments. Jeannie, do we have anyone asking to make a public comment?
We have not had anybody formally ask, no.
Okay. Then we can move to council comments. I will here mention that, and that was the reason for my question to Jeannie, that I was approached through email by a resident on Pilgrim Road making a plea for the installation of a speed hump on Pilgrim, in addition to the 2 that we voted to have the DPW install for rural lane. I encourage this individual to voice that concern tonight, and pointed her toward Jeannie to, not that she has to register, but just to get it recorded. But I see that she's decided she can't or doesn't have, not able to do it. But for the record, there has been that outreach for consideration of a 3rd speed hump. Any other council comments? Okay, then we can manager's report.
Thank you.
Ms. McNally.
So the last couple of weeks since we last met have involved more Zoom meetings, capital reports to the Finance Oversight Committee, and general budget planning, which is becoming an exercise, somewhat of an exercise in futility, since we still don't have any solid numbers from the Commonwealth on which to base our revenue estimates for fiscal 21. So at your last meeting, you did approve the 1/12 spending plan for July. And as of this afternoon, I was on a call with the statewide CEOs, with the Mass Municipal Association and the Lieutenant Governor and the Commissioner of the DLS, and was told that the Commonwealth expects also to do a 1/12 budget for, at a minimum, July and August, if not September and October. And there has recently been an extension granted to business owners for sales tax and tax turnover. That deadline's been extended through with no penalties and interest, according to the commissioner. So the receipt of and the estimates of revenues for local aid, I'm certain will be deferred even beyond what we originally thought. In the meanwhile, though, we did receive the CARES funding that was applied for. Approximately $175,000 came in to the town a few days ago. And that is only the 25% of the COVID expenses that we've expended. The way they calculate the reimbursement is that they subtract what they anticipate FEMA will repay you for and give you the difference. And then all of the accounting, final accounting, takes place later. So we're in of allocating the expenses to, well, I say we, it's really Olga, who's moving all the line items for expenses that we have paid in response to COVID into a certain trust fund line item that is specific to that receipt of that money and the payment of those expenses. I reported in my report to you that was authored a couple of days ago that I did hire Steve Lonergan, who's the current city treasurer in the city of Springfield and has been for the last 10 years as our new municipal finance director. Steve has an MBA from Bentley. He's someone with whom I had a professional affiliation over the last 10 years or so. I'm very confident in his ability to assist our other department heads, to be a great influence on the assistant town accountant as well as the treasurer and the assessor. He's got a great background in all areas of municipal finance, and he'll be in the building on or about July 6th. So I'm very pleased with that announcement. The town is also still continuing to work on assisting local businesses with its reopening. You know, the indoor dining followed quite quickly on the heels of the outdoor dining. I guess we were all excited on June 8th, thinking that we were going to try to assist local business, and lo and behold, less than 2 weeks later, indoor dining is now allowed. But just today, another business, Bentley's, was approved by the building commissioner for their outdoor site plan. We've been working very hard on making sure that all of the new regulations that apply to different phases are honored. This week, Monday, to be precise, just yesterday, the camps opened at Pine Knoll, and they were greeted with such enthusiasm, not only by Donna and Prather and Jordy, but as I said in my report, there were 170 registrations on the first day that registrations were made available. So there's a lot of pent-up demand for that service, and the camp counselors are thrilled to be there. Jordy did invite me to give a few remarks at the training, which was last week, which I was happy to do. So they're very enthusiastic, looking forward to administering those camps within the guidelines and protocols that the Commonwealth is requiring. The transition of our dispatch operation to Westcom is underway. Ryan's been instrumental in maintaining contact with Erin Hastings, the executive director at Westcom. I spoke with her last week just to make sure there weren't any last minute issues that she had a concern about. They were going to send their couple of supervisors out to our dispatch office this week to observe the East Long Meadow protocols and make sure that they could accommodate the specific operational demands that our police department and fire service want. And then ongoing, we'll be a member of we'll have a vote on the operations committee, which is on their board, subcommittee of their board of directors. So, but we're moving fine in that direction. I'm also pleased with Bethany Yao's contribution so far. She, under a very short deadline, with some assistance from the planning board and members, employees at the Pioneer Valley Planning Commission, was able to submit a grant application, which, if honored, will grant us some assistance towards creation of a master plan for the community. So she really did a good job. That report was reviewed before it was submitted by me, as well as by the grants administrator at the Pioneer Valley Planning Commission. So we're very hopeful that that grant will be forthcoming. I did interview 2 candidates this morning, for a position in our HR department as a generalist with to assist primarily with benefits administration seat, which has long been vacant. So hopefully that decision will be made on which person to hire within the next couple of days. And I did also begin the renewal process for the cable television license. Got a letter today, actually, from the representative for Charter, and we're going to set up a meeting in the near future to discuss the potential contract arrangements that we might entertain. And last but not least, we did have a very generous decision, I'll call it. It's not a gift to the town that you have to move to accept, but it's essentially a gift to the town from the board of directors of the Friends of the Library. Over the course of our planning committee in anticipation of this year's submission to the council. One of the projects of kind of it's been on the list for years, and it was recarpeting the library, and it was over $100,000. We were able to find a way to get it done by installation of carpet tiles versus broadloom. I know that's maybe more detailed than you need to know, but
What color?
I thought it might be appropriate to just ask the friends if they were interested in making a contribution, and they were. So they are going to pay the vendor directly. We're using a local Tomorrow carpet. The work is going to start on July 9th. Carpet's been delivered. The samples book have been delivered. The carpet's been picked out. And so everybody's very happy, and we can get that project done, take it off the capital list, and it can be done while the library is closed. So with less inconvenience, obviously, to everyone. So we're very pleased about that. And I really want to thank Diane Tiago and Laura Palmer and all the other members of the Friends Board for listening and entertaining that request and acting on it favorably. So that's it for my report tonight.
Thank you.
Thank
And
you.
thank you to the Friends of the East Long Meadow Library. That's a significant contribution and a significant deletion from our capital, our 5-year capital planning projects. So again, we thank them for that. Any questions for Mary at this time? I'm sorry, Mike.
Mary, how are you tonight?
I'm okay, Mike. How are you?
I'm doing good, thanks. You mentioned Director of Finance taking a position in the town hall. In other words, is he going to be working from the town hall on July 6th?
Yes.
So him coming back, is there any other plan on when the remainder of the employees might be back in town hall?
Oh, that was another topic that came up today in our statewide call. The advice from Boston is still stay away, work remotely as much as possible. I might have misunderstood your question. Steve's employment will begin on July 6th. He will take over the ante office there that's in the current finance department. Whether he'll appear daily, I don't know. I think in the beginning he probably will, but there's no plans to reopen town hall to the public at least until the end of July. And as I said, as of this afternoon's telephone call, the advice is continue to work remotely as much as possible for as many of your staff as can. As of July 1, there's an increase in the occupancy that's allowed up to 50%. However, town managers have the discretion to declare everybody that works in town hall essential. And so therefore you can have 100% occupancy if you wish, but my sense is that that's not a wise move for us right now.
Okay, the only reason I ask is I've had a couple of residents reach out and ask the question. So when you mentioned the Director of Finance coming in, I didn't know if he was going to occupy his workplace from the town, but I can see it's give and take. He work from home, work from town, whatever's appropriate. But at least we know that maybe it'll be readdressed at the end of July. So that's the answer I'll be able to recite to those asking.
Yeah, we're thinking about a lot of different things. Maybe appointments, maybe establishing some kind of a kiosk in the vestibule of the entryway. There's still some anxiety about having a lot of traffic in the building. So, I mean, I have not heard any complaints. At least they're not filtering through to my office. So if you are getting them or other people are asking you questions in that venue, please continue to let me know, because at this point there are no plans to reopen.
Thank you.
Ralph.
Hi, Mary.
Hi, Ralph.
I'm going to go back to an old subject. Now that we are going to have a new finance director, will one of his first duties be the audits that need to be completed?
You're talking about the audits under the bylaw as a result of the departure of certain key employees?
That's exactly what I'm talking about.
It's going to be on his to-do list. It's been burning a hole in my legal pad, but we've got many larger issues in finance than that one, with all due respect to the fact that that's overdue. We do not have our fiscal 19 audit report ready yet, based on some information that has not been obtained through third-party sources. We need an actuarial estimate on our OPEB account in order to complete that, and I'm very much concerned about getting that done so that we can file our that information with the auditor, complete the 19 audit, because it has trickle-down effects into our bonding capability and various other significant financial consequences. So the bylaw is on my to-do list. It absolutely is. But we just have to prioritize, and I'm not sure that's going to be number one, but maybe it'll make the top 10. I hope so.
Thank you.
Any other questions for Mary? Okay, seeing none, we can move to item 6, approval of minutes. In your packet, you have the June 9th, 2020 open session minutes. If there are no additions, deletions, corrections, I'll entertain a motion to have those accepted and approved.
Motion to accept the open session minutes from our town council meeting held on June 9th.
I'll second that.
Motion's been made and seconded. Further discussion? Hearing none, again, because we're remote, all of our votes must be roll call. Marilyn?
Yes.
Ralph?
Abstain.
Don? You're muted, Don.
Didn't want to hear the fan going on behind me. Yes.
I am a yes. Mike?
Yes.
Tom? And Pat?
Yes.
That motion is approved. Those minutes are approved 601. Okay, our next item is communications, correspondence, and announcement. And this evening we have acceptance of veteran memorial materials valued at approximately $40,870 from the East Long Meadow Veteran Memorial Committee. And this is per Massachusetts General Law, Chapter 44, Section 53A and 1/2. I believe I see Carolyn Brennan in the audience. Ryan, is she going to bring this forward this evening for the council?
Yeah, I'm pulling her in right now.
Carolyn, can you hear us?
I can.
Oh, there you are. I just saw a picture before, but now that's good. Okay, so we're at that point, and do you want to speak a little bit about the materials being donated, or however, to the town, the legality around that?
Sure. So last year, the committee was able to get $100,000 earmarked from the state budget to purchase items for the memorial, but it needed to be spent before the end of this fiscal year. Now, having said that, we literally just found out today that we don't have to spend it all down until we have some time after June 30th. But before that, so they purchased a lot of the monuments themselves, the flags, the lighting, pavers. So in order to, we needed a place to store it. So they purchased a trailer and container, and that the fire department has been wonderful to let us put that container there with all of the items, with the intent and understanding that most likely the fire department will probably use that after the memorial is built. But in order to have all of that very expensive items insured, we needed to donate it, make an official donation of all those items to the town, and Terry Glusko, who has been working diligently, still doing a lot of grant requests and looking for sponsorships. He's the chair, and he wrote a letter to Mary regarding an official donation to the town of East Long Meadow. And that letter is what was sent and needs to be accepted.
Thank you. Questions for Carolyn? So if I can just reiterate, this is a formality for, so that these materials can officially be insured
Yes.
under the town's liability clauses.
Yes.
Okay, if there are no questions, I'll entertain a motion to do just that.
I move that the town accept the Veterans Memorial materials valued at approximately $40,870 from the East Long Meadow Veterans Memorial Committee per Massachusetts General Laws, Chapter 44, Section 53A and a half.
Second.
The motion's been made and seconded. Further discussion? Hearing none. Again, a roll call vote. Marilyn?
Yes.
Ralph?
Yes.
Don?
Yes.
I'm a yes. Mike? Did Mike? Oh. It looks like his screen is frozen.
Yeah, he's frozen. Hey, Mike,
Are you still connected?
can you hear him?
I can hear what he just said, but his screen is frozen.
Your screen is frozen, but we can hear you.
Oh, now you can't hear him either.
Looks like he's muted now.
He's muted.
I'm not sure. I got you on speaker now, so you can talk to the group.
So we're doing the roll call now, Mike, relative to the acceptance of the Veterans Memorial materials. Okay, I'm going to move over
Yes.
and Pat.
Yes. And thank you,
And-
Carolyn.
And yes, and thank you, Carolyn. I'm not sure what to do about Mike's inability to be heard.
Well, Mike, can you hear Kathy?
I can, and I'm a yes for the
There we
the
go.
acceptance of the veterans. And I think what I'll probably do is leave the meeting and try to come back in because my screen's frozen.
Okay. Thank you
Yes.
for that. And that
Okay.
motion passes unanimously.
Okay?
Yes, thank you.
So I'm going to jump out and then I'm going to jump back in.
Okay, moving on to number 8, public hearings. We have none scheduled for this evening. Orders of the day, licensing matters, again, none scheduled for this evening. And now we go to financial matters. And this is to approve an appropriation of $34,083.34 from the ambulance receipts reserve for the appropriation fund for the purpose of covering fire department shortfalls. And I also see Chief Morissette in our audience, and Ryan's going to bring him forward to speak.
I think I'm in.
There we go. Hi, Chief.
Hi, how's everybody doing tonight?
We're
Good,
good.
hello.
How are you?
Good.
Everybody's inside a cool place right now. So typically, everybody hears from me, the council hears from me, and back in the Board of Selectmen, I try to keep everybody involved all along with the status of the fire department's budget. And when I submitted the budget back in December to Mary and Sarah, Sarah wanted to wait a little bit. And I knew I was going to run short, but I didn't know what that number was going to be. So I think her mind is wait till we have a realistic number. And we went through a couple months and then COVID hit, and quite unfortunately, it wasn't the highest priority on my list at that time. And so when things settled down the end of May, we started looking at it, and that's when I reached out to Mary and we started putting our numbers together, working with Olga, what we have in our revenue account and where we are for expenses, not counting what we're going to request from FEMA and through Mary's care assistance that she's already received. And we've had some unexpected costs with the ambulance. We've had, first of all, one of the big ones is our billing service. I appropriated $15,000 for billing. I predicted about $500,000 in ambulance transport revenue, and currently we are, just about $895,000 in revenue. So that increased that budget, that line item in the budget quite a bit, from my 3% that I was anticipating of $15,000. So that bumped it up over quite a bit. And then we've had two big, the Rescue One, our first ambulance is actually over 50,000 miles and it's out of warranty. We had a brake job done on it early back in February. And unfortunately now the air conditioning system, we had a major overhaul of it. The compressor itself failed and required us to replace every component in it because the internal components of the compressor went through the system and there was no way to rebuild it or fix it without replacing everything. My fuel charge has gone up quite a bit just because of the amount of runs we've done. And the same thing on the medical supplies. Because of the amount of runs we've done, it's almost impossible to predict. The good part with all of that is the fuel charges for April, May, and portions of June, we are going to submit for reimbursement. The same thing with the medical supplies for March, April, May, and June. We're going to submit those. So those numbers aren't on this piece. And another good part is with our ambulance receipts reserved for appropriation, in that fund, currently we have a surplus of about $125,000 over what the current approved FY20 budget is and what my requested FY21 budget request is. So that's where Mary and I, we talked about, we have the money, but we can't spend it. Theoretically, we can't unless it's appropriated. So. Everybody get that?
Yep.
I'm a little confused with the numbers. You said, or you mentioned that the vehicle supply, gasoline, and medical supplies will be reimbursed.
So one of our FEMA public assistance request is for emergency actions or emergency protective actions, and everything the fire department has done since the start of COVID, and I'm using the date of March 16th, maybe a couple of days prior to that. Some of the overtime the fire department's put on and the fuel for the ambulances, it's in preparation for our COVID response along with actual COVID response, not just preparation. We needed to make sure the fire department was ready, and we did. I mean, we were able to get that second ambulance with your permission and blessing, and that ambulance itself, in the short time it's been here, has provided about 160 transports on its own. That was a great help, and it allowed us to make sure we could protect our residents even better than what we were doing.
Yeah. Again, through the chair, a follow-up question. So those two numbers are in this total of $34,083.34.
Which one? I'm sorry, Tom.
For the vehicle supply and medical supply, the gasoline there?
They are for everything up until February, correct?
So this is the amount that you'll need, but some of that's going to come back into the fund when it's get reimbursed. It'll go back in that fund.
No, those funds are in the different account. I know I heard Mary talking about Olga's separating everything out as far as our COVID requests that we're going to be asking for FEMA, and everything we've been told so far is this is definitely a reimbursable expense for the town. Fuel, overtime, and the materials or the supplies, medical supplies.
Okay, so this money gets returned back to the general fund.
The other, the $34,000 that I'm asking for right now is not any COVID expense. So no, this money is not coming out of the general fund, so it wouldn't get rid. I'm sorry.
No, I'm just referring to the two items I mentioned, Chief.
Right.
Sorry, I just want to be clear on, we're going to allocate those funds and approve the expenditures that come out of the ambulance fund. But you stated that the money's going to be reimbursed by
So
FEMA for those two.
Those two items are prior to, in this request for 34,000 are prior to COVID. So no, we're not asking for reimbursement of that because it's prior to March. This is prior, the vehicle fuel and the medical supplies is prior to March. So we're not asking for reimbursement on that. That's a different fund that Olga is currently managing.
Anything prior to March 1st is not subject to CARES reimbursement.
Okay, so where do we come up with the $34,083?
That's the sum total that Paul has spent or incurred in expenses on because of the additional ambulance runs beyond the appropriation that was made by the council. Right, Paul?
Correct.
I understand that, but I'm looking at the document that was provided and it shows $1,325.11. And then it shows 16,261. And then I think the first one was 10,711. Those don't add up to $34,083.
No, they should.
Mary, Tom, is that the email I gave to Mary?
It's a handout that was provided to us for the meeting discussing your request.
Yes, I have not seen that. I think those numbers came right off my email. I believe that $34,000 mark was the number that before Olga started moving items around was the number that the account looked like it was short, but there's still some items that are getting moved out of the ambulance appropriation FY20 account into the COVID account. So that that number, the basic premises is the money that is going to go into this is going to cover the shortfall in the accounts, and that's coming right from the receipts we've already received, the revenue.
I understand. Again, I just wanted to make sure I understood the FEMA reimbursements for the last two items. The vehicle supply and medical supplies will be coming back to the town and going to general fund.
No, not those, not the 1951 and not the 3833. That is prior to March. So we're not looking for that. That's what we overexpended prior to COVID.
Okay, I'm sorry, Chief. I'm just confused because the last sentence says COVID account will be seeking FEMA reimbursement.
Right, that's for items that aren't on this list.
Okay.
I haven't seen that, so I don't know
Well,
exactly.
Tom, that sentence, the last sentence that you're referring to says,
March.
please note that the charges for March, April, May, and June were moved. So I think what the chief is saying is that all of these were for prior to March.
They are.
Okay,
Pat,
thank you.
Thank you, Kathy. I'm struggling the same as Tom because I see a request to approve 34,000, but this memorandum that we got says that there's a $21,950 shortfall, and then goes down, proceed to describe the largest amounts that went over. There's nothing anywhere here about 34,000 in this documentation that we have, Paul.
I understand.
Once we create it. That's why I'm confused.
Right. I'm not, again, that 34,000 was, I think, prior to Olga moving items out of those specific accounts that were earmarked for COVID.
So what are you really asking for? 25 or 34? I mean, 21.9 or 34?
What the department needs to cover the cost right now is that 21,950.19. Unless Olga has something different. I don't know if Olga's on the board now or not, but that's
She's
what.
here tonight, Paul.
She's not here?
I
Sorry.
don't believe so.
no,
Okay.
she's not in the viewing.
Mary, am I making sense?
No, I see the number you're referring to, yeah, and I had the same, the chief and I went through this when he sent this originally because the 21,950 number doesn't jive with the itemization. Those issues that are all set out in the email do total $34,083.34. It was, I think we're having an overlap because well, I'm not even going to try to explain the accounting because I don't want to further confuse myself or anybody else, but we can pass this. We'll do it next time. We'll get a number of what you're actually short, Paul, if there's some
Yeah.
confusion we can't rectify here.
Mary, question for you, I guess. Is this something that you need an answer on tonight to make this account whole and to pay the bills?
I don't think so. I think we have some leeway after June 30th. We can straighten it out.
Yeah, I mean, I don't think anyone, I mean, it's coming from the fund, which is for that purpose. I don't see a problem with it, but we need to know what the amount is.
Pat, thank you.
Thank you. Thank you, Kathy. Would it be helpful for us to vote the 21,950 that we see here and pass that? And perhaps that's the right number because perhaps the difference between that and the other number are the supply of gasoline and the medical supplies. So we could at least provide the bulk of it. Because I too agree with Tom that we understand where these overages came from. We agree with them and we know the money's there.
Any other comments to that?
I'm
Mike.
just hearing, I believe, that it's not time sensitive, so maybe we're better off before we throw anything at this. Let them rewrite it and delegate where the funds are going. If it's not time sensitive.
Isn't it this year's budget?
Chief?
I think some of the confusion might be there is some line items in that account that have a surplus that weren't expended. So there is, for one, the overtime account is there's some extra money there, and our intercept fees, we don't some money there. So there was a few line items. Totaling those up real quick in my head, it's close to $12,000. Actually, it's close to $13,000. And then there's another one that's pretty big, and that's the software support item. It's just some of this worked out with our software, where one of the charges we didn't have to pay this year because when we got the equipment. So I think that's where that discrepancy comes from. If you look at that original list, yeah, it totals more than that 21 that I'm looking for, but based on what's actually in the ambulance receipts reserved for appropriation account or fund, the shortfalls are on that $22,000 mark.
Yeah.
But we can come back.
Pat?
Thank you, Kathy. My concern is just that this is the last council meeting of the budget year. If he needs this money in order to pay some bills or make some changes to the 2020 budget, this would be our last chance. Otherwise, it has to be an after-year expense. I could be totally wrong.
Well, Paul, you're suggesting that the 21 is the amount you really need, despite
Yeah.
the fact that they total 34.
Correct.
So
Correct. Yeah,
maybe
that 21,
that's
that 21,950.19 was the number that we had.
that you know you're short.
Yes.
And I would be in favor of leaving it in this year.
I agree with Pat.
Okay.
Any other
So,
discussion? Then I'll entertain a motion with that adjusted figure.
I move to approve the appropriation of $21,950.19 from the ambulance receipts reserved for the appropriation fund the purpose of covering fire department shortfalls.
Second,
Motion's been made and seconded. Hearing none. Marilyn?
Yes.
Ralph?
Yes.
John?
yes.
I am a yes. Mike?
Yes.
Tom?
Yes.
And Pat?
Yes.
Okay, then that motion with the amended amount is approved.
Thank you.
Thank you, Chief.
Thanks, Chief.
Okay, moving on to old business. We have nothing under that topic today. New business, the approval of an East Longmeadow shared local public health partnership. And with us this evening is our health director, Amy Petrosky, and two members of our Board of Health, Dr. Sarah McAdoo and Karen Robitaille. Ladies, good evening and thank you for joining us. So,
Thank you for having us.
Amy, I'll give you the floor right now and your board members to give us the necessary background.
Start, but Mary, do you want us to?
Oh, I'm sorry.
That's okay.
Whoever
I
wants
just
to start.
have a couple of remarks just to set the stage, sort of the historical stage. But it's perhaps information that the council's already familiar with, but I'll be brief. This shared health initiative is the result of the recommendations of the Special Commission on Local and Regional Public Health, which was created by the Mass Legislature in August of 2016. And that body was comprised of about 25 various dignitaries and experts from the health field, as well as some legislators. And they issued their final report in June of 2019, making 6 specific recommendations for the enhancement of the public health in the Commonwealth of Massachusetts. However, while that report was being authored and investigated, the town of East Longmeadow applied for and received over 4 different grants designed all to promote the institution of this shared initiative. One from the, well, 2 actually from the Pioneer Valley Planning Commission in the amount of over $31,500. Another one from the Commonwealth in the amount of $55,500. And the last one from the Department of Public Health, the amount of $75,000. So there's been to the extent that that grant funding is evidence of the Commonwealth's desire to promote shared health initiatives, I think the town has already received, as I said, almost $180,000. These grants were applied for by my predecessor as far back as February of 2018. And as I said, their design was to primarily to increase cross-jurisdictional training in the public health services field and strengthen the service delivery capabilities of the various small towns in Massachusetts that, as standalone communities, are falling short of the missions of the state's public health initiative. So we've been working since I've been here I've been working with Amy and with our colleagues in Longmeadow to try to get to a point of whether or not we can finalize an intermunicipal agreement that has probably 12 iterations already. And what we're asking you tonight to consider is just whether or not you want me and Amy through her department to proceed with this initiative as a goal. We're not asking for any ultimate approval tonight. In fact, the last iteration of the IMA is still with council, but we've been over it many, many times. And it obviously can always be amended and edited as we go through. So the most recent IMA was authored in May. And just prior to that, in late April of this year, the governor enacted, or the committee enacted this State Action for Public Health Excellence program. signed into law on April 29th, which again is a repetition of the desire to create incentive grant programs to support the effective delivery of services. So I'm kind of being redundant. The goal is to improve services, and the theory is that that happens by economy of scale and sharing of resources and increased level of attention to certain mission statements that the Commonwealth has. So having said that, and maybe it's stuff you already know and have heard before from Amy's presentations to you, but I'll leave the technical explanations and the detail to her and to her board.
All right. Sarah, do you want to start in the public meeting?
Sure. Good evening, and thank you again for the opportunity to be here, even if it's via Zoom. But I wanted to start by making the statement that since both myself as the chair and the vice chair of the Board of Health are present, that the meeting has been posted in accordance with open meeting laws. And we're going to start with having Amy kind of give an overview of our progress so far on the shared local public health partnership with Longmeadow. And then myself and Karen would share some other aspects of that new law that Mary referenced.
Great, thank you. So thanks again for, I'm reiterating, having us here. We haven't seen each other in about 3 months and it feels like an eternity. So it's nice to see everybody, even if it's virtually. So for some of you, hearing about this shared service agreement is the 4th time we'll be discussing it. And for some of you, I think it's just the 2nd. So without taking too much of your time, I think Mary did a good job kind of bringing you up to speed. We first applied for a grant in November of 2017 with the Pioneer Valley Planning Commission that was awarded to us in February of 2018, and that's what began this process. In November of 2018, we came to you with the report of the Pioneer Valley Planning Commission, which talked about, laid out the different types of shared service arrangements. They laid out their recommendation for how we should proceed, as well as the pros and cons of the different models and doing nothing or doing something. Since that time, we've been working really diligently to come up with a plan that worked for both Longmeadow and East Longmeadow, and that increased the level of services without increasing the cost as much as possible. And luckily for us, that meant actually, we'll talk about the budget, but that actually meant an increase of services and a decrease in costs for us now and in future years. In the past, we've talked to you all about the 10 essential services, and Pat has some questions today about we've really done a lot to invest in our local public health system, both from the delivery of the inspectional services, our education to our community, and prevention of disease. And he's wondering, how have we I think what I was getting is, how have we invested this much and still not meeting the essential services? So I want to point out that the only place that we are not meeting the essential services is in the nursing services. And that is the primary benefit that East Longmeadow is going to get from joining this or signing this MOU. In addition, we didn't even know this when we were seeking this, but the Council on Aging has always had a nurse for our seniors, and that position ends this Thursday. So starting this Thursday, we have no community health nursing to offer our residents. That nurse specifically was for seniors, and the nurse that we seek is for all residents. But with the loss of that position, this service becomes even more imperative and important, because these services are important. Some things that that nurse was doing that our public health nurse was going to do for the greater community was TB screening, diabetes blood testing, blood pressure testing, connecting our residents to medical resources so they had someone to help them in that process. And that's all things that our residents have not had. We look at the current pandemic that we're in, and we've had to contract out at a very, very high rate our nursing services. Luckily, we received emergency funding from DPH to do that, but right now we're at about a little over $17,000 that we've paid to the nurses that we've used. And had we had a nurse on staff, that burden would have been significantly less. So that is the primary gain for us. I mean, I think East Longmeadow is in a fantastic situation in terms of our delivery of public health services, but we aren't there with our nursing services. So we've thought about all the positions that you'll see in the org chart. We've thought them through that to try to really maximize the delivery of their services and their capacity, but not overburden them to a point where it's not possible to get the jobs done, while still filling the specific needs of each community that each community brought to the table. So that's kind of the overview, and I'll let the Board of Health take it from the policy perspective.
Thank you, Amy. I think I'm thinking back about when we started, and at least as the chair of the Board of Health coming on board about 3 years ago, one of the questions that sort of has been shared is sort of like, well, after spending this money, sort of like, why aren't we there just yet? And I was just reflecting, thinking back where we started. We really started with when the charter came along, that we were starting from scratch. And that I remember that first presentation saying, wow, we really have a long way to go to be able to meet our public health essential services. And more importantly, we had recognized from the data that we initially looked at that we were at risk of not only not being able to protect the health of our residents, but actually potentially putting us in a position of being liable if certain certain services were not provided, and one of them is doing inspections. So the reason why it sounds like why aren't we there yet is because there really has been a whole lot to do since 3 years ago. And I really think that all the work that we've done together, that means with the town council and us having the opportunity to come and share with you what our needs have been and what we need to do to get there, and that every time you've supported that, I think is really important for us to acknowledge how far we've come. And I think what Amy has shown is how over the past 3 years, we've made these incremental progress to move towards sharing public health services in order to meet these essential health services in the most cost-efficient manner. We understand and respect what it means to make sure that we are saving money. I think we've shown you that we've been able to do that, even just an example of the recycling. You know, that is exactly what we look at, is where do we maximize using what we already have? Where is there an opportunity to have more resources coming into the town? So I think that looking at that number, you know, the amount of grants we receive in isolation, I think that gives proper context to what it took to even get there and what it took to get that funding to support where we even are at this moment. That also goes to show you the level of complexity of what it takes to build public health. What you've recognized during this COVID-19 pandemic is the fact that how poor public health infrastructure has existed. And that's why Amy has pointed out how much it has taken just to try to make sure that we're tracking and that we have other things that was beyond the scope of maybe we might be able to do in order to protect our community. And you can see that across towns, across the state, across the nation, people are struggling just to try to protect community residents. So I honestly think that that amount of money, the 100,000 plus, is actually a drop in the bucket to be able to even meet our standards. And that helps you to understand how critical public health is to not just protecting the health of the community, but putting the community in a position to be economically viable, right? So this pandemic is obvious of that. If we don't have public health in place, it is really hard for our businesses to be able to do what they do best. And that's where we want to get, keep people healthy and keep our community moving. So I think I want to, remind in the moments that we've had the opportunity to talk is that this incremental progress is an example of the proactive strategy that, to put the town of East Longmeadow in that position of strength. And this proactive strategy, and please just humor me for a moment, reminded me of a quote from one of the greatest hockey players. And this came into my mind only because it was applying to another project I'm working on, and thinking about, Wayne Gretzky, when he said, "I skate to where the puck is going to be, now where it has been." That's the strategy that our health department has been using. Because if we stay at where we're supposed to be, we're just gonna make it. But if we really think at paying attention to emerging health issues, I think we're gonna be in a much better position to allow us to determine if we can meet any new challenges or related to health and policy that are coming down. this pandemic, the way you've seen unfolding, is not going to be the only one. We know that in the health community, this is going to be one of a few others. May not be called a pandemic at that level, but the pandemic is going to show how there's going to be a lot of challenges, even meeting with things like immunizations, which I'm thinking about the event that the department hosts in the fall, usually for our residents to get vaccinated. So we know the pandemic is already causing some sort of like backstop in some of the services that people are going to need. So this is not just for now. This is really preparing for tomorrow and a lot of the other challenges that are going to come down the pipeline because of COVID-19. So the health department has paid attention to this. And I think that it's put us in a stronger position for this new SAFE program that Mary referred to, a law that was signed into place by the governor in April of this year. And as Mary mentioned, that it is SAFE is the acronym for State Action for Public Health Excellence Program. Again, the pandemic has stated how incredibly important that is. Mary had mentioned that there were three main things, and one is ensuring that all members of public health workforce have access to essential service. It's not enough to have people in those positions, but it's more important that they're qualified and have the highest level of their ability to carry out their responsibility. Two is creating an incentive grant program to support more effective and efficient delivery of care. That's where we're positioned the strongest to take advantage of. And then the third part is sort of where we're going to already, which is moving Massachusetts towards these national standards, not just local or state, but national standards across the board. So, the shared local public health partnership with Longmeadow will put us in that better position to compete for this new incentive grant program to support implementation, especially related to public health nursing, which my colleague Karen will really focus on next.
Thanks, Sarah. Good evening, everyone. I'm speaking to you as not only a member of the Board of Health, but also as a public health nurse. And I should say I do work for the Department of Public Health, so I'm intimately familiar with not only legislation, but the workings of the department, and in particular, everything that has happened due to COVID-19. And I spent 20 years in school previous to that, and so school health was the original form of public health nursing in the country. So proud legacy there. What I just want to talk about as far as the nursing services is kind of the importance of those services, and obviously it's part of it is what Amy and Sarah have already alluded to, providing preventative health care for our residents, particularly our senior residents, offering immunization, which as Dr. McAdoo already alluded to, is going to be extremely important as we have seen vaccination rates fall, particularly among young people, by as much as 60 to 70% during this pandemic. So we've got catch-up work to do, and it may be that we need to offer clinics outside of the typical place, such as the pediatrician office, in order to accomplish the urgent task we have in front of us to get people immunized. But probably one of the most essential functions of the public health nurse is disease surveillance, tracking, monitoring, and case management. The public health nurse is responsible for monitoring MAVEN, which is the IT system that manages all of this disease information for over 90 reportable diseases, everything from measles to tuberculosis to COVID-19 to foodborne illness. And not only is the public health nurse responsible for tracking this, but for providing services in case management are necessary. So for example, in the case of tuberculosis, oftentimes people need medication management, and that can mean the nurse even going to the home to ensure that people are taking their medication for tuberculosis, and that's codified in statute. So it's very, very important. Certainly during COVID-19, why we need public health nurses. Everything you've heard in the news about contact tracing and how important that is to stopping the spread of this disease, all of that is typically carried out by public health nurses. And what happened in the state, we didn't have enough of them. And we didn't have enough people to actually do the contact tracing and the case management for people. And the governor actually spent our money to stand up a contact tracing initiative to work that normally is by public health services. I can tell you, because I'm intimately involved with that contact tracers, they're embedded in the community. They don't know the community. They don't know what the resources are. I'm in charge of school health for the state. That initiative has reached out to my school nurses to help them with case management. Your school nurses are working with health nurses to do the contact thing because there aren't enough public nurses. This is a problem. And we have an opportunity right now to fix this problem for our community. And I really hope that you can support this, as we now have seen just how important this can be. Thanks.
Thank you,
Karen.
Lydia.
So, we're here now to answer questions or concerns. We've provided you with a lot of documentation. The Longmeadow Board of Health and the Longmeadow Board of Selectmen have voted unanimously to move forward with this arrangement. And we're hoping to have conversations with you about what it looks like in East Longmeadow.
Okay, so counselors, if you have questions, we can begin that piece right now.
So,
Ralph, go ahead.
so I'll start. I got home today just in time for a meeting, only to find an email with a bunch of questions that Pat had sent that I haven't even had time to read answers and all to. It appears to me like the council and myself have many questions between the initiative between Longmeadow, East Longmeadow. I've had them for months. I've asked about OPED, I've asked about the finances, and I don't even know if they're included in these documents. I don't like receiving stuff like the day and say, hey, you got to vote on it tonight.
Well, all the information was provided last Friday, but Pat sent me information, questions today, and we thought it would be beneficial for the board to see the response to that. I mean, any questions that you have, that's what this time is set for. But we thought it would just be good for you to see what Pat had already asked. If you haven't had a chance to read that, I'm happy to answer questions right now.
Okay.
That's what this time is for.
Town of Longmeadow, the Board of Health Department. What was their budget last year? I mean, I know Beverly Hirshhorn personally. I know she's in charge of Longmeadow, but I didn't see any other finances. I didn't see any breakdown other than the employee breakdown that you gave me. I mean, are we going to be saving money when we combine on paperwork? And I mean, we're losing, in my opinion, we're losing our director half the time because you're going to be spending time in Longmeadow instead of in East Longmeadow. I mean, to me, that's a con.
Right. And I think in the past, we've also talked about this, but I'm happy to address both of those things. I don't have Longmeadow's full operational budget. I do in the budget layout their staffing budget, because that was really where we're at this point. You know, Mary and I have not wanted to move forward with spending legal fees and getting the OPEB liability. I mean, that's a process that we don't want to spend time or money on unless the town council is behind it. If you're not behind it, there's no sense of going there. So we're hoping tonight to have your support behind this so we can go and get those answers for you, the OPEB liability and the other financial liabilities, unemployment, disability, health insurance. So that's all things that are on our plate to get you.
There
in terms of my work, and one of the reasons that this is a good opportunity is because we'll use COVID for an example. When I send out a letter to our restaurants every single time a phase changes, Beverly is sending the same exact letter out in Longmeadow, right? So we're taking two health directors doing the same exact letter to their food service establishments, getting paid to do the same thing. Whereas if it's just me, I can create one letter, put LEL or the partnership at the top, and all of the restaurants get the same letter. Beverly and I go to the same trainings. The communities pay for the same trainings, the same maintenance of certifications, the same meetings. We're on the same executive committee. So really, Beverly and I sometimes drive to Springfield or Worcester back and back to each other. So instead of, you're not losing me part of the time, we're making me more efficient and allowing me to do the same thing I'm already doing for you for another community. Now, there are going to be things that come up in different towns that are going to require different responses from me, and that's what we're going to find out. This agreement, we can leave with a notice, and if it seems that we're not getting either the director, whomever that might be, or the partnership isn't working out for us, we can find a way out of that. You know, it's written into the MOU the way it stands with notice. But after 2 years, we're looking at the staffing arrangements and we're saying, okay, Longmeadow is using more of the nurse because they've had more need for a nurse in the past, but East Longmeadow is getting more of our inspectors because we have more food service establishments. Those are things that we can't know the answers to unless we try this out. And both town managers are on the same page with that, right? That we are going to look at this again in 2 years with data, with factual data. Part of the thing that I've come to you guys with the past of, hey, these are the inspections we're not doing. This is the staffing we need to meet them. I track now every single inspection, complaint, call. We have all of that data for you guys now. So if I was to need something or you guys had questions or concerns, hey, what did you do with this address? We have it all well documented. And that's the same thing we're going to bring to Longmeadow. So we're going to have that data after 2 years of where our staffing is being used, where we might be able to be more efficient, and what is or isn't working. We've also built in quarterly, they call it leadership meetings, where the chair of both boards of health, the town manager, they meet quarterly to discuss what is working for you, what isn't working for you. So we've built in the checks and balances of our leadership in both communities to make sure that the arrangement is meeting the expectations of not only the statutory bodies, which is the boards of health in each community, but also the town managers of each community. Because really, those are two different entities that I have to make happy.
So Amy, I have a question I'd like to pose, and that is, if this is a 50-50 split, if you will, you know, sharing the services, I'm not clear on why all of the employees in this organizational chart will become employees of the town. That makes me nervous with OPEB obligations and workman's comp and insurance and such. Having been working with our finance subcommittee for the last 3 months, we are trying to put a budget together for the upcoming year, and it's predicated on hope that from the state level, the Baker's administration's budget, it has sufficient funds in it to do what it needs to do for all towns. But it obviously the pandemic has just taken all financial matters and tossed them into the air, and there is significant uncertainty about how much funding a town like East Longmeadow or Longmeadow will ultimately get. The Finance Committee has reviewed and multiple times most department budgets. We've taken a hard stand that we can't add personnel. We've taken the stand with some budgets that we've returned them to various departments and said you need to cut more. So in that environment, I'm personally struggling with how do I balance this request? And I have no issues with the philosophy of the partnership. But at this point in time, knowing that the state budget may not come to us in some form of reliable numbers for 90 days or more, how do I convey this information to the finance subcommittee? We've asked, the schools to take a hard look. We've asked DPW. We've asked most of our departments to cut, and yet I'm just concerned that we're talking out of both sides of our mouth right now. I would like to myself err on the side of being cautious and revisiting the number piece down the road when we have a little better opportunity from Beacon Hill to understand what they're going to live with for numbers.
Right. So I hear two major concerns. So I'm just going to reiterate to make sure I understood them properly. First is the unknown expenses. So the OPEB liability, the health insurance, and we don't have answers for that. But I know that Longmeadow expects to pay their share of all of those positions. So while we're increasing positions, they're taking on the burden of the liabilities of those positions, right? That's the anticipated end game for this. They understand that. I'm just pulling up the org chart. So right now we have the health inspector and we have an administrative assistant. So we're the lead health inspector and clerk. So that would be the Longmeadow, let's just say those are Longmeadow edition. And really the only thing we're adding is for 35% nurse. So the only position we're adding that isn't going to be compensated for by Longmeadow is the 35% of the time nurse. And so they'll cover the other 35%. And the other question you had was the adding, how do we justify to all the other departments in our residents adding staffing when everyone else is being asked to cut due to these issues? And I would say that even adding this position, we're still saving money on our budget. We'd be saving the community this year alone over $16,000. And the projections for next year without any budget, without any grant. So fiscal 22, that $25,000 is with no grant money. And we've already seen from both Sarah and Mary the talk of the state is planning to put their money where their mouth is in terms of investing in local public health because they've seen the problems that it has created during this pandemic, and we know it's not going anywhere. So to answer the question about the finances, we're saving money. This project was never intended to save money. It was intended to strengthen our delivery of public health services. But it just happens that we're also going to save, I think it was $15,000 this year and $25,000 next year. So, that may not help people feel better that are losing positions or telling them that they need to be cut. But when you look at the bottom line is savings.
Thank you. Marilyn.
Hi, good evening, Amy. Just so that you know, I'm the new kid on the block. I haven't seen this information before Friday. And so I've been doing crash course in this partnership. And not to reiterate what Kathy has said, but basically I am concerned that we will be responsible for all of the positions, the benefits, the retirement, which clearly the numbers are not known. As I look at how we entered into the pandemic, I knew that East Longmeadow was in good shape. So I'm talking about East Longmeadow. I'm just focusing from where we're coming from. And, I attended the seminar that you presented over at Brownstone Gardens with Paul Morissette. I was so proud of the fact that we had a health director, a health inspector, we had administrative stuff. We were prepared to deal with the pandemic head on. I realize other communities weren't that fortunate, but our missing link was a public health nurse. I'm a nurse, so I get the importance of it. So I'm not trying to circumvent the need for such a resource in our community. I support regionalization. I support sharing of services. Why not just look at a nurse position and share the nurse position? We're joining the Westcom emergency dispatch at the end of the month. And the whole argument to join was that we weren't dealing with staffing, we weren't dealing with the expenses. We were, as a community, we were going to get this wonderful service, but all we had to do was pay for our fair share of that. And that to us was a no-brainer. This whole process is philosophically is the exact opposite of why we went into Westcom. So I'm having a hard time struggling with the commitment that this town would make, not only to Longmeadow, but to any other community that wants to join the partnership. I'm just not sure that I have enough information to make that decision. So I just wanted to be upfront.
Yeah. So one of the questions, I just want to try to make sure I understand what you said. You asked why we should do this and not just join the nursing position. So the top line of that is it wouldn't save us money. So part of the reason we're saving money is because we're splitting my salary. They're going to be without a director, and you're getting out from underneath half of my salary. That's where we're getting the cost savings. The second part is that there are going to be incentives. I mean, we know that the SAFE law has passed. There are incentives coming to moving forward with this. And I understand that you may not be ready right now because this is the first time you're hearing about it, but that is why. It's not about, just sharing the nurse to get that piece met. The state is moving towards a shared public health model, and we're on the cutting edge of that. And I have come before many of you 4 or 5 times now to say, if we move in this direction, we are going to be eligible for this. We're going to be eligible for that. It's been kind of a ladder of progression. And each time I've explained kind of what's coming down the line from the state in terms of funding and in terms of anticipation of expectations. And what we've seen moving forward is what I've kind of told you, and that's all kind of culminated in this special commission report, which says shared health services is the direction that not only the governor, but the public health professionals are saying we need to go. But on top of that, they're now putting money behind that. And now with this SAFE law, they're making even a greater statement that this is the direction they anticipate all local public health will go. Massachusetts is one of less than 5, I don't have the exact number, but one of less than 5 states in our country that does not contribute state aid to local public health. And I think this pandemic has reaped the benefit of that failure. And this SAFE bill is trying to correct that. And so that's my other reason. It doesn't help you feel safer in terms of OPEB liability. But the reason we're not just looking to share that one position is because this is the future of public health. And yeah, I think I've said it.
Can I just
So
add
I
one
hope
thing?
I've kind of addressed that. Yeah.
Sorry,
Or that's through the chair.
Marilyn, I appreciate what you're sharing. And I think the 2 things that came to mind is when you were at that meeting, kind of hearing sort of what's been in place in East Long Meadow, that was not by accident. That's been worked on for the last 3 years to even get to the point, again, about just meeting essential. We're not doing anything extra. We're just trying to get to the point of, do we meet the basic standards? So are we at like the starting point? The second piece to that I have been observing as healthcare has been transforming is that, and this is from the position of a physician, is where change is going to happen, whether we want it or not. But there's a difference whether we can call the shots and sort of help lead our community to take a leadership role in that, or whether we will sort of be pulled in that direction. So what this allows us to do is sort of be at the forefront of how transitioning to the model that Amy is sharing with you, how can we be in a strength to make decisions that are going to work for our community versus being told what we have to do and with whom. When you look around at the other towns in our region, we have a real glut with the number of people in the public health profession. We do not have people with the skill sets in certain positions of leadership because we haven't yet built that infrastructure. And I think that that's really critical in sort of the phase that we're going into in public health. So I think that although this is not a specific answer to it, I think it's keeping in mind how I'm watching in medicine, how we're sort of being pulled to some changes and there's voices that are not at the table to make decisions. We have the ability, as Amy has shared, to be actually at the table. One is through Karen's position. She's at the tables to kind of understand what's happening at the state level. Amy's at the table at the local and regional level to know sort of where we are and can be engaged and have shared sort of where we are as a town. And we are being asked a lot of questions about how we're doing this, how we're putting that together. So I think is, again, trying to always position our town in a position of strength. So it's not whether this is going to happen, it is, but are we going to be in the position to make a lot of those sort of decisions for a town in a position that we can lead instead of following?
Don, I'm sorry, I was muted.
The pro and con list, who wrote that?
That was me.
Did you? If I own, which I do, I own a business, but let's say I expanded the business and I had the manager of one business say that for efficiency, I'm going to have this individual manage two businesses. And the argument would be is that the budgets for both offices would be split. I'm pretty confident if that individual wrote, this would place significant additional workload and responsibilities on the director's position. The next time he or she asks for a job review or would ask for a significant pay raise. So I really want to see the numbers. And, you know, I know we can't forecast that, but if your job is going to be a department head in Longmeadow, a department head in East Longmeadow, working on their health budget, working on our health budget, I would be stunned if you didn't ask for a next review, ask for a pay raise, and then what are we saving? So I kind of—
The raise is in the raise. Mary and I talked about this, and there's a placeholder in there for a raise. Right now, I'm making $77,000, and the placeholder in the budget I provided for you was a $15,000 raise, and so it brings me to $90,000. And that's a placeholder Mary and I have not negotiated. But you're right. I did expect to be, if I'm taking on this additional work, to be compensated for that. So I built that into what was provided to you. So there is no hidden fees. There is no gotcha. This budget isn't really what it is. I've really tried to be as transparent as possible. I've worked for you guys now for 5 years. The extra workload, you've seen the workload that I've been able to carry before we had inspectors, before we had an admin. I'm not afraid of work. I've never been afraid of work. I've been doing COVID. I mean, you guys have seen that from me for 5 years, and I understand what I'm getting into. I'm not doing this to be idealist. I'm not doing this because I think it's just going to be fun. I think this is the future of public health. I'm trying to support the town of East Longmeadow to getting the best services they can, and I'm willing to work my butt off to make sure that happens. And, in 2 years, we might look at this with the town manager and say, hey, you're just not able to carry the workload of this. But I'm going to do everything in my power to make sure the next 2 years that doesn't happen if this is something you guys sign off on. So there's no hidden fees.
In my humble opinion, I think you've done an amazing job. And I've been in government for quite a while, and you're the best that I've ever seen. So I want to let you know that. The problem is going to be you decide to go elsewhere. The hard work ethic, that dedication, that commitment that you have, that's going to be a tough sell to bring someone in who's another Amy. That's going to be a challenge, because this position is going to be hard to fill. And I remember that with Robin, when Robin worked for the planning board, and then she retired, and it was going to be like, how do we get another Robin? And and you're of that cloth, hardworking, frontline, forward thinking, and I know we're very fortunate to have you on board. But I also just have to look at it also, as Marilyn pointed out, also the optics. The optics are going to be, we're going to ask other departments to reel back, and we're going to have to now sell. I'm just thinking this is a great idea, if further information, but is it a great idea in June of 2020, or is it a better idea in June of 2021? And I don't have the answer. That's just a question to throw out for discussion.
Don, I'm with you about keeping Amy. You're right. You don't see that. We don't have many people that can be in that position. That's why the issue of filling the shoes of the work that Beverly has done for the town of Longmeadow, I think, is challenging. I'm with you, trying to make sure that we support Amy's leadership for the good of our town. Other thing is, even looking at that, I at least had the privilege to be at the beginning discussions of when everything was being put together. not in the conversations at the nitty gritty part, but overall the strategy. And the goal was, how do we make sure that East Long Meadow is covered in Amy's role? I can share with you that I have seen shared role, even within an institution as big as a hospital system, in a public health role, where there was a VP that did two roles, one that was within the institution and one that ended up being the spinoff outside of the institution for about 15 years. So that the time was split. But I think that what I paid attention to, especially Amy, as you were developing the structure, was what type of support did she have? What kind of team did she have in place so that she's working at the higher level? And then how does her team may take care of a lot of the day-to-day detail and how she can supervise and to make sure that's done. So I've never owned a business, but I do agree with you is in, can this structure support her doing her best work? Does she have the team? Because it takes a team to do the work. It's not gonna be Amy. And I think with this setup, I think we're in a good place. And as Amy mentioned, one of the things that I wanted to make sure that our team in discussing this included is who's going to do the oversight, who's going to be looking at, are we making sure those things are getting done? And I think that oversight group that Amy talked about, that leadership group that we meet quarterly, I hope that with some feedback from the town council, we will have a strategy of what should we be looking at to make sure that you know, these goals are getting done and where we can support the team to make sure that can happen. So we're with you on that. So we are working hard to figure out to make sure we're able to do that.
Marilyn.
Amy, quick question. As far as the philosophical health perspective, you know, I'm not challenging any of that. I'm looking at the administrative, the actual orchestration of host community you know, as part of this process. My question is, who made the decision that East Long Meadow would be the host community and why?
Because their health director was retiring and I'm not. So, and we had the majority of staff. We have, like we've talked about today, a very functioning department. And so with a few additions to our team, we could help Longmeadow and help ourselves. So that was the reason. If we wanted to go to the table and ask Longmeadow to keep this, I don't think that they would have a problem with that. I mean, I wouldn't want to leave East Longmeadow, and I don't think any of my team would want to leave East Longmeadow, but we could certainly see if Longmeadow was open to being the host community.
And I hope you understand my concern is the future, the long range, you know, responsibility, liability of becoming a host community, and then making whoever joins us, they will become our staff people as well. And I look at East Longmeadow having been in a pretty decent position, with the exception of a public health nurse when we went into this COVID situation. And now we're being asked to consider looking at, you know, different administration of the health department with greater responsibility. And there's just not enough information for me to say yes tonight.
So what is it that I can provide for you for next time to help you feel more confident?
We don't have a crystal ball, Amy. I just don't know what our commitment will be in terms of long range support of these people who will become East Longmeadow staff. You know, it's and dividing, and you're our director, but now you're only being half of our director, starting with this new program. And you know, I'm not sure that that I am ready to, or that we should be ready to make this decision based on the reasons why we went into Westcom, for that reason alone.
So would you feel more confident if it was in Longmeadow?
You know, but you're asking me if I want to say goodbye to Amy, if I want to say goodbye
No.
to that we know.
You're saying goodbye to the OPEB liability, because it seems like from what I'm hearing is that's the biggest concern, right? The OPEB liability, the other financial burdens.
I mean, you are asking us to make a decision based solely on the public health need, and I get that. It's what East Long Meadow was buying into in terms of long-term commitment with Long Meadow or Hamden or Wilbraham or Munson or any other community that wants to join us.
Pat, and then, am I muted?
No, we can hear you.
Pat, and then Mary has something.
Thank you, Kathy, but I want to see if what Mary had was in responsive to this issue.
My comment was just going to be about the OPEB liability. It's a speculative number. We'll have to get an actuary, and I don't know how we would perform that exercise now to give you a sum certain, because we don't know who the employees are, what their longevity will be. I mean, that's throwing a dart at a blackboard.
But
We
it's
don't
my,
have the numbers for our town employees for fiscal 19, so we're not.
but it's
gonna-
my understanding, Mary, that that cost will be picked up by Long Meadow in the sharing of the
Yes.
costs as
Costs will be.
it's renegotiated during the time. So it is a liability. It potentially could be a liability if they quit, but for now it's deemed to be sort of a wash because they're reimbursing it. Is that not true?
Well, they're reimbursing 50% of it.
Right.
Yeah.
Yeah. Okay, so thank you, Kathy. I thought I was all prepared that I knew what was going on because I've been paying attention to this issue and being really essentially supportive of it. But I heard something today when it opened up, we're not being asked to approve. We're being asked to approve the continuation of the investment. I mean, because I looked at this and like, we need to approve the local partnership. And I thought that's what we were doing. And I thought, man, we just don't have the numbers yet to be comfortable with the grants, the budgets, the state reimbursements. There's so many moving pieces. And I'm very much in favor of continuing to look at this public health partnership, recognizing that it does appear in some ways to be more beneficial to Long Meadow than it is to us, but it's not beneficial to us either. But now that if it's a matter of should we proceed, should we support the investigations, that's a different issue than saying, yeah, we got to vote right now and we're in or we're out. And so I want to clarify that from anybody, Mary or Amy, that is that where we are?
I think Mary, you should answer that question because it sounded to me like that's how you introduced it.
It is how I introduced it because we anticipated these concerns that have been expressed by many of you, the uncertainty about the numbers. Amy and I have had multitude of conversations about her ability, not her professional ability, but her personal ability to manage this partnership, as well as all the other things that are managed, and COVID being a perfect example of the stressors on the position on the person who holds that position. So we're not blind to it. And that's why I'm asking, my thought was, and I think Amy shared it, is that give us some direction, because this is an enormous investment of time and effort, meetings with Long Meadow, grant reporting, grant applications, moving the needle forward. And if you're disinclined ultimately to do that absent some specific financial numbers, then I would like to know that so that we can move on to the next project, whatever it turns out to be, and take back that energy that we're all expending on this. I hear you saying you all more or less think that the initiative itself philosophically is something you could support. And I fully appreciate the financial constraints that the chair mentioned, specifically in terms of funding. Amy and I talked about that this morning. All this public health endorsement by the Commonwealth, there's still a question of what's the funding source, and that concerns me as well. So I just want to know if you want us to keep moving forward or you want us to pull the plug and just say, let's just work on something else. Because we can't keep doing this. And that's why I say it's been in the works for 3.5 years without culmination. So I don't know. I guess I like to just know where I'm going.
Oh, that's fair. And it's certainly evident. And those of us who've been on the council for a number of years know how much truth there is in the backstory about the steps that have been taken and how it took 3 years to get to this point. Pat?
Kathy, my question, I guess, would be at this point, should we exercise should we move to approve the continuation of this and see if that gets a vote, or would Mary be happy with an informal poll of all of us? And I think I raised because as chair, you could determine whether or not you would like to pursue one or the other.
I'm going to look to Jeannie for a minute. Is it what's more appropriate to do? A consensus, a verbal consensus, or an actual vote to move forward with the finessing the details in the partnership?
What
Even
sounds
though
like,
it's non-binding.
what
Right.
sounds like the agenda item originally was for an approval, then it turned into something else within the last week, which is
Yeah.
understandable. So I think it would be appropriate for a formal motion to continue to move forward, but not approve. Not that not approval has to be in the motion, but I would think a formal motion to move
Direct the manager and the health director to move forward with investigating all of the unknown aspects.
Yes, especially with the conversation we've just heard tonight, I think a formal motion would be appropriate.
Mike?
He's muted.
He's muted.
Mike, you have to unmute.
Thank you. So here we go. I'll make a motion to continue conversations. Let me find my place here. To continue conversations between Mary and our health department regarding the Long Meadow, does it say East Long Meadow? East Long Meadow, Long Meadow Shared Public Health Partnership.
Will that suffice for you, Mary and Amy?
It's really about Mary.
She's
Oh, you're
muted.
on mute.
Now, Mary.
I will say that Long Meadow's director is leaving in January 1st. So Long Meadow is interested in how they're going to fulfill that position as well as their public health nurse. So and the grant that we have is to have a 6-month overlap during that process. So we can continue to explore, but I do want I want to be transparent with the town council that eventually Long Meadow is going to need an answer.
Right, and I don't think it's the intent of the council to just put this on the back burner and walk away. I think we want a little more breathing room is what I'm hearing. Pat?
Understood.
Thank you, Kathy. I would like to support Mike, but I think that we need to also authorize them to deal with the town of Longmeadow. That's really what we're asking them to continue to investigate with the town of Longmeadow and with both town managers the feasibility of this partnership. Would you agree, Mike?
I would. I was putting it together as I started, but I think including East Long Meadow and Long Meadow, phrasing both. So if I try it again as make a motion to approve to continue conversations between the town of East Long Meadow and both town managers regarding East Long Meadow Shared Local Public Health Partnership.
I second.
Motion's been made and seconded. Further discussion. My question to Mary would be, if the motion in this form, will that give you, does it give you what you need to move forward?
Well, how well, yes and no. Because I think the financial aspects are what's troubling to most of us. And if we said, well, let's move forward, I mean, we can continue to discuss, and we've actually had a lot of discussions. So I think the draft intermunicipal agreement that Amy, that actually was part of your package for tonight. I don't know what discussion that other than proceeding to try to get an actuarial evaluation, the potential OPEB liability. But I guess my point is that the financial questions the troubles aren't going to go away in 3 months. They're not going to go away in 6. So I don't know what we're really accomplishing. I mean, we want to keep the door open, certainly. I don't know if we can get an extension on some of that grant funding to extend. I mean, Amy makes a good point. Beverly is retiring and Long Meadow's going to be without a director. And I mean, obviously that's their problem, not ours, I suppose. But we don't like to think like that. So you're helping out, but maybe, I don't know, Amy, what do you think? Another deadline see if we can get a grant extension or something to prolong this?
They're not. We won't get a grant extension.
You don't think so?
So because the grant now is under that SAFE law.
Yeah.
So it's
Yeah.
changed. And there are timeframes and deliverables that we have said that we
Right,
would.
I know.
And it is a planning grant. So if we continue to talk and plan, get the actuarial services, we are still in compliance. You know, a lot of the money from this round is going to purchase inspectional tablets, gear that identifies us as LEL, not East Long Meadow or Long Meadow. So there's a lot of the implementation costs that are going to be covered with this $54,000 that we have this fiscal year. So I mean, I'm not great with the actuarial policy process. That's not really a skill set of mine. So if the concern is really the liability, and we come back to them at their next meeting with an actuarial assessment, if that's something that's going to allow them to feel comfortable saying yes or no, then we could extend this to the next meeting. But if that's still not information that we could provide them that's going to make a difference in the decision making, I feel like we might be punting for the sake of punting.
If I can clarify, if as you say, Long Meadow is going to contribute 50% of associated OPEB responsibilities, then to some degree, even though it's exceedingly next to impossible to predict what the blah, blah, blah. For an actuary to even conjecture a formula to come up with a number is somewhat moot, as long as we are assured that whatever that number is, big, small, medium, Long Meadow is going to assume 50% of the financial obligation.
That's addressed in the IMA, that
Yeah.
all of our costs are going to be subject to that distribution or sharing.
Mm-hmm.
I think the one thing that we don't know and can't predict in the financial sense is what is this state budget going to ultimately look like in the fall when somebody on Beacon Hill says this is the final budget and these are the final cherry sheet numbers and here you go. If when that comes back, those numbers are not favorable to the town's financial health, that's when maybe we get into some trouble if we, and it's a big if we have to be faced with making deeper cuts in all of our departments. That could, and I'm just putting it out there, I don't wish it to happen, that could upend some of your org chart. And if it upends East Long Meadow, it's certainly going to upend Long Meadow. They're not going to get good news, and everybody will get bad news across the Commonwealth about the state of reimbursements. So that was my thought when I said, can this wait a little bit to see if numbers become more apparent and more solid from the state side of things. Pat, I see your hand up.
Thanks, Kathy. Based on Mary's last statement, it appears like we're reverting back to being asked for approval at this point, given that we don't anticipate having any better information 3 or 4 months from now. So to delay 3 or 4 months and not to get additional information, it's looked like we're looking for approval now. So I think it might be appropriate to ask if Mike would withdraw his motion, which doesn't seem to be what is being looked for. And maybe we should just vote to extend this or to table this for now and talk and decide amongst ourselves with the next month whether or not to give them the approval that they're really looking for, absent any kind of final figures. That's just where I think we seem to be.
So Mike, that suggestion is out there to withdraw your motion.
It seems that's the direction we're heading, so I will withdraw that motion at this time. And I'm not sure, Pat, are we looking for a motion to table this to a date further down the road, which will give the council some time to be able to work on this? And
I move we table this discussion to a future meeting.
okay,
Second that.
Pat made a motion. Tom, did you second it?
I did.
So my purpose, again, because I made the motion, I would say I am in support of this. I was ready to vote yes to Mike's suggested proceed. I understand Mary's concern that we have nothing to proceed on with Long Meadow because they're all on board. And so I am in favor of the motion, but I think that it would be difficult for us to vote tonight. And so that's why I made the motion, not to give any signal one way or the other, but to give us another chance to look at it and not wait 4 months.
Yeah, I agree, Pat.
Just a procedure point. Can we table without picking a date? Should we table to the July 14th meeting or something of that nature?
I would be most comfortable with some kind of parameter on it. Mary?
Yeah, the 14th, you're going to be doing your budget, and the 28th, I'm not going to be in town.
Right.
So the next two, but by the first meeting in August, perhaps we'll have the legal counsel's comments on the IMA, which will address some of these financial concerns. I don't know that we'll have any further clarity on the budget, but I was going to say to that point is Long Meadow's in the same boat that we're in, a smaller scale perhaps, but whatever the state aid formula or distribution is to our communities is going to be the same situation that they're in. So, and there's an exit strategy. If this doesn't work because both towns are incapable of supporting it financially, then we'll have to address that as a prospect for termination. I mean, that's the reality that this is given to every topic that we have. So I think we can incorporate language that gives us that exit if it becomes necessary.
I was just going to add, if Pat, would you want to amend your motion to add the date of tabling this conversation to August 11?
I do not think that is necessary. I think we could raise it whenever we want, but I will amend my motion to August 11th.
Is there a second to that amendment?
I'll second the amendment.
Okay, the motion's been made and
Now
amended.
we have to vote on the amendment.
Yeah.
That's what I was going. There's a motion to amend the original motion to include the date revisiting no later than August 11th.
No, I think that, excuse me, Kathy, the date was on August 11th, not.
Right.
Or on August 11th, okay. Ooh. Is everyone clear on that now?
You get a roll call vote this?
Yes. Marilyn?
Yes.
Ralph?
Yes.
Don?
Yes.
I am a yes. Mike?
Yes.
Yes.
And Pat?
I'm a no on the amendment.
Fair enough. Motion passes 6-1-0. So now we go back to the original motion then. We don't need an original motion.
Well, it's already on the table.
It's on the table. So now we have to vote again. Am I understanding that correctly? I feel like I'm chasing myself around the table here. Motion's been made to postpone a decision on the shared partnership between Long Meadow and East Long Meadow, shared health partnership, until August 11th. Is there a second?
It's already been seconded.
Other discussion? Oh, hearing none. Marilyn,
Yes.
Ralph,
Yes.
John,
Yes.
I am a yes. Mike,
Yes.
Tom,
Yes.
and Pat.
Yes.
Okay, that motion passes unanimously. And so we will revisit this to see if there is any other solid information that is known at that point, as well as to hear the findings of our attorney as to any tweaking that the IMA might need. Ladies, again, thank you for all of your work and all of your help this evening.
Yes, thank you for chatting. If there's anything that I can answer in advance of that August meeting for you, Marilyn, if you want to chat it through, or Ralph, some of your concerns, I'm happy to set some time up to do that.
Okay. Thank you.
Thank
so
you for
much.
having us.
Thank you all.
Bye.
Bye.
And we have one other item of new business tonight, and that is a first reading of a proposed bylaw for ground-mounted photovoltaic systems moratorium. And I am going to, where is Mr. Page? Right there in the middle of the screen. I'm going to kick this conversation to you because you've got the most background and have a good grasp on the chronology of this journey to get to this point.
Great. Thank you, Kathy. Ryan, is Russ Denver still in the audience from the planning board?
He is.
Yes.
Is he willing to join the meeting?
We're about to find out.
There he is.
Hello.
Hey, Russ, how are you?
Okay, Ralph, it's all yours.
I reached out to the chairman of the planning board with regards to the moratorium. The moratorium had come in front of the town council through the previous planning and community development director. She had asked if the council would be in favor of having the create one. The direction was yes. So it went back to the planning board. The planning board created a bylaw. They held a public hearing on it, and then they turned it back to the town council. At that point, I've picked it up. I noticed that it wasn't in the correct form to be adopted. So I took the language that the planning board had created, and I simply put that exact language into a form for adoption. And with that, I would turn it over to Russ to have him explain exactly the moratorium that the planning board was looking to have done.
It's all yours, Russ.
Well, I think the long and short of it is after the petition by the developer that's in land court, we all felt that we needed a little time to be able to respond not only to the court, but also to design a new bylaw that would be in compliance with whatever court actions come out of the case that's currently before land court. So to have sufficient time to be able to do that, we felt a moratorium of a year or longer would be appropriate. And I think that's what Mr. Page has put in front of you.
So through the chair,
Yes.
it would probably be appropriate at this time to do a first reading of what's been presented to us.
Okay. And do you want to do that yourself? Or do you want the clerk to read it?
I would love it if the clerk would read it.
Sorry, Jeannie, for putting you on the spot.
That's okay. Petitioner, East Long Meadow Planning Board. Representative, Russ Denver Planning Board Chairman. Proposed bylaw for ground-mounted photovoltaic systems moratorium. The East Long Meadow Planning Board proposes the addition of the following articles to be inserted temporarily into the East Long Meadow zoning bylaws 1991 revision until such time that the moratorium is no longer in effect. 7.50 ground-mounted photovoltaic systems moratorium. 7.501 notwithstanding any other provision of the zoning or general bylaws to the contrary, the town of East Long Meadow hereby adopts a temporary moratorium of land or the building of structures for ground-mounted photovoltaic systems that are at least 40,000 square feet in area or over 250 kilowatts of energy production. The moratorium shall be in effect through October 22, 2020, or until such time as the town of East Long Meadow adopts the zoning bylaw amendments that regulates the installation of ground-mounted photovoltaic systems, including in residential zoning districts, whichever occurs earlier.
Thank you, Jeannie, for that.
Madam President, I saw Mary McNally's hand up. I don't know if Mary wanted to add something to that.
I did. We had Jesse Tim Belcher review this, and I don't know if Bethany was able to reach you, Russ, or anyone to discuss the recommendation that October 22nd date be extended out.
Yes, yep, and I agree.
So I just wanted to be sure that we had a year, because his point was that now what is it, is June, so there's only a few, 4 months, and that he didn't seem to think that was sufficient.
So whatever you feel comfortable extending it beyond October 22nd is fine with the planning board, I'm sure.
I participated in that phone conference with Mary and Bethany and Jesse. And Ralph, were you in that?
I was not.
No, Jeannie was, I'm sorry. And Jesse had 2 recommendations. One, what Mary already stated, that he felt we were leaving ourselves way too short with staying with the October 22nd. And he felt that a year from now, give or take, would be a much more appropriate deadline, and one that he knew the general would not have issue with. And secondly, the Attorney General will have issue with this bylaw unless there's a preface to it explaining the conditions under why East Long Meadow wants to move forward with a moratorium. And so I think he also said that go through the first reading as we are right now, but prior to it coming to a second reading, which is the public hearing, make sure you do your due diligence and insert that language and agree upon an extended date. So.
Well, I think it would be great if he could just provide the planning board with those, with the appropriate language, and perhaps we could amend that when it comes before the planning board.
So,
and I expect us to act on this at our meeting in July. So we would like to get it back to you as soon as possible.
And Russ, your meeting in July is what date?
It is the 3rd Tuesday of July.
So we'll be meeting the 2nd Tuesday, which is the 14th. You're meeting the 21st then. All right, so we will be in a position, once we do our little bit of editing homework, to act on it ourselves after, at the end of the public hearing, and then give it to you so that your board can act on it.
Yeah. And I just want to remind people that there is one other solar project that was approved by the planning board, and it was at Cardamundi, but that was in the appropriate zone.
Right.
So forward, and this would have no impact on that.
Right. Yes, and to be clear, in the preface, one of the rationales for the moratorium likely will be, you want the moratorium for requests wanting to site a solar project inside a residential.
Correct.
And it's exclusive of citing a project in Industrial Garden Park or in other zones where the
it's allowed.
Uses allows it. Pat.
Thank you, Kathy. Boy, that is really unclear to me, Russ. I saw that including residential zone district at the bottom, and I thought including meant that that was included along with all the others. So you're saying that this moratorium only applies to, or this proposed moratorium would only apply to proposed photovoltaic systems in a residential zone?
I see Ralph shaking his head. So
go ahead, Ralph.
Clarify.
I'm going to jump in. The reason they put including residential zones is because of the court case, which mandates that ground-mounted photovoltaic can be in any zone. So we wanted to make sure that it wasn't just a moratorium on our existing bylaw, that it included all zones, including the residential zone.
Okay, but I thought I just heard that that wasn't the case, that it really is only a moratorium in the residential zones. Is that not true?
Currently, the way it's written, it's all zones.
Okay.
And that's what you meant to do. So Cardamundi is excluded because they're already underway, so they've already started. But
they're already permitted. Yep.
But you would not allow any future ones.
Not until this has been resolved.
Okay. Thanks.
Is that how you understood it, Mary?
Yes, and he
Then
forwarded that language from the Town of Athol decision that the AG had just acted on and approved, so maybe we could
very unclear.
Get that to you, Russ.
Okay.
Although yeah, it just has to have your purpose articulated. So.
Right.
So through the chair?
Yes.
It's my understanding that the way this bylaw process works is the planning board has already created it. They've already held a public hearing. They've now submitted it to the town council. If we have amendments to make to it, that it's our job to make the amendment, to vote on the amendment, to hold a public hearing, including those. From what I can read in the charter, this doesn't go back to the planning board. This is in our seat now. They've returned it to us. We take it from here and move forwards with it.
Right.
And with that being said, what I would like to do is at least take a couple votes tonight. One is to change the date. I looked, June 22nd, 2021 is the second Tuesday in June, which is roughly 1 year from now. My other concern is the size of the ground-mounted photovoltaic array. I'm not quite sure the 40,000 square feet in area or 250 kilowatts of energy production. We have none of that currently in our zoning bylaw. I would say that the moratorium should include the ground-mounted photovoltaic systems. Doesn't matter what size, it's all ground-mounted systems. We put a moratorium on it. They create a bylaw which covers all ground-mounted photovoltaic systems. Suggestion.
Anyone else? Pat.
Thank you, Kathy. But I think if we're going to have a 1 year moratorium and it covers every zone and every size, that is not going to be perceived as very friendly by the state government that wants solar to be pushed. And so I thought the reason for the limitation was we don't care about the small ones. We're concerned about the big ones. And so that just one man's opinion, I would feel less comfortable with removing that number. The number could be changed. I'd be happy to consider changing, but I would not be happy with a 0 and a year's delay.
I have to agree with Pat on this one. I think overly inclusive may not have the desired effect. I think having a number, or even if we tweak the number, is fine. And the end product, I would just quickly bounce it off Attorney Pill just to see what his take is on it, as it may, as he's involved with the land court matter.
Ralph.
So currently in our residential zone, business zone, commercial zone, ground-mounted photovoltaic arrays, as written in our bylaw, are not allowed. So if we go with our bylaw, the only zones that allow it are industrial, garden park, and industrial, which is where the large ones would be. But we're putting a moratorium in on all zones. That's why I said to remove the size limit, because our bylaw already says that they're not allowed in residential zones. Although the courts may say differently, that was my thought process on it.
If we remove the particulars, the parameters of wattage and acreage, will that make the wording too broad and subject to rejection by the AG? That would be a concern. And then if that, in fact, that's the case, we are burning up time, if you will, work back and forth with it.
That is my concern.
Under the Athol bylaw, there was no such restriction that I saw.
Okay.
I'm just reading the decision in the land court case, and it just seems to play into it that we have a policy against solar. And I think by having some fair restrictions on it for purposes of trying to work on a green bylaw or something to that effect would be beneficial and not create the wrong message.
So could I suggest, I know it may not be my place, but could you maybe take a first vote this evening and then work on amendments for the second and third readings?
That is essentially the recommendation from Jesse, our attorney, Mary. Isn't that how you understood it? We have to do the first reading tonight by law, but then between the end of this evening and the point that it goes to public hearing, we've got to finesse the language to suit our needs.
Yep.
Yes, exactly.
Okay.
So Kathy.
I just, 1 second, please. Jeannie, I know you need a certain amount of time to post announcement of that public, but when you post it, you also have to have the specific language as well, correct?
Right, so I posted it for the reminder for this Thursday and next Thursday, and what I have online is what I just read for the first reading. So if you vote on a change, I suppose I could add language to that, at the meeting of June 23rd, this change was made, and just include it with the supporting document for the bylaw.
Okay, so now I'm thinking in terms of a calendar. If we still need some time to decide on the specific language that needs to be included in that. And our next meeting is July 14th.
Mm-hmm.
So we either have to build in another meeting of this body or push out that public hearing to July 28th.
Well, you could have the public hearing on the 14th and then continue it. Then you could continue it to the next meeting if you haven't have everything all
right, that's fair.
Settled yet.
Ralph?
That's what I was actually going to say, is just because we hold the public hearing doesn't mean we have to vote on it that night. We can still make amendments and all after that based on what we hear from the public. They may have some suggestions.
Okay, that's fair. Any other discussion? Hearing none, we'll entertain a motion.
Oh, I think that's me. It's Pat. Pat, would you like me to read it?
Oh, I'm sorry. I move that the second reading of the proposed bylaw for a ground-mounted photovoltaic systems moratorium take place at a public hearing scheduled for July 14th, 2020 at 6:30 p.m.
Second.
Motion's been made and seconded. Is there further discussion? Hearing none. Marilyn,
Yes.
Ralph,
Yes.
Don,
Yes.
I am a yes. Mike,
Yes.
Tom,
Yes.
and Pat.
Yes.
And that motion passes unanimously. Thank you for that.
Mrs. Hill, if I could I'd like to thank you and Mary and Ralph for shepherding this through. I know it kind of got lost there for a little bit, but I want to thank you. And I also want to thank Marilyn Richards, who is always available to the planning board to kind of keep us abreast of the multi-use zone committee and how that is moving forward. It's great to have some cooperation between the two boards. So thank you very much.
Thank you. Okay, we are down to summary and action items for the next meeting. I have one item of homework, if you will, for the council, and that is to, if after looking at the charter, you have any suggestions or edits that you would like the Charter Review Committee to take under consideration, and then would you kindly send them in an email to me by noon on Tuesday, the 30th, which is a week from today, because that committee is meeting later that afternoon. And it'll give me time to pull it all together and get it into a format for them. Other than that, I don't have any other, well, the other action item is we need, hopefully Ralph and Marilyn and Mary and I and Don, if he wishes to finesse the proposed language that needs to be amended into that bylaw. But we can do that maybe in a conference call and over the next few days or next week. Anybody see any other action items for next? Okay, then we have no executive session scheduled for this evening. So that said, I will entertain a motion to adjourn.
So moved.
Second.
The motion's been made and seconded. All those, no, I can't do all those in favor. Marilyn,
Yes.
Ralph,
Yes.
Don,
Yes.
I am a yes. Tom,
Yes.
Mike,
Yes.
and Pat.
Yes.
That motion passes unanimously. We are adjourned at 8:16 p.m. and we will be back in session on Tuesday, July 14th at 6 p.m. Thank you and good evening.
Good night.
Good night,
Good night,
everyone.
all.